Hello, and welcome to this episode of In Discussion With from PharmacyUpdateOnline. Today I'm talking to Shania Liu and Jonathan Penm about their research into opioid dose tapering before hip or knee surgery. Why don't you start by introducing yourselves?
My name is Shania Liu, and I'm currently a postdoctoral research fellow working at the University of Alberta in Canada. Before this, I completed my PhD in the University of Sydney, looking at a pharmacist-led opioid tapering program.
And my name's Jonathan Penm. I'm a senior lecturer at the University of Sydney School of Pharmacy in Australia.
And can you give us a brief overview of your current roles, what your jobs involve? Shania, could you start?
My current role involves leading two large randomised trials, looking at pharmacist-partnered management of chronic conditions such as cardiovascular disease. I'm also continuing to be involved in the pharmacist-led opioid tapering work that I know we'll be discussing today. And we're continuing to look at the impacts of opioid tapering before hip and knee replacement surgery.
And Jonathan?
I'm an academic pharmacist who does both teaching and research. I'm also affiliated with the Prince of Wales Hospital doing research with their pain team. My area of interest is evaluating hospital pharmacy services to reduce patient harm and to keep them out of hospital. I'm currently running a few randomized controlled trials on that, and in particular, we're going to talk about one of them today.
Now, you have carried out and recently published a study concerned with the tapering of opioid doses before total hip or knee arthroplasty. And this is what I'd like to talk about today. But first, what's the background to this? Is there a problem with opioid use before this type of surgery?
So the background is looking at the patients who are undergoing hip and knee replacement surgery, what they're using these opioids for. So they're really looking, we're really using these opioids for end-stage osteoarthritis, which is chronic pain, essentially. And we know from existing research that opioids are often no better than simple analgesics like paracetamol or acetaminophen or anti-inflammatory pain medicines for osteoarthritis-related pain. So these opioids are not providing any additional benefit, and yet they carry the risk of additional side effects, such as drowsiness and a risk of falls, which obviously we don't want. So the evidence, in addition to this, also shows that opioid use before surgery is linked with worse outcomes after surgery, slower recovery after surgery, and a greater risk for long-term opioid use as well at 3 months after surgery. So a lot of things that are undesirable that could largely be prevented. And that was the focus of this trial, to see if we can, number one, taper this opioid use before surgery.
I've heard of the OpioidHALT study. Is that the same as this?
The OpioidHALT is an acronym. So with all research trials, we like to give them catchy names. And this is no different. OpioidHALT stands for the Responsible Opioid Use for Hip and Knee Arthroplasty Randomized Clinical Pilot Trial.
And how common are these operations, total hip and total knee arthroplasty?
Total hip and knee replacement surgeries are among the most common elective surgical procedures performed around the world, with over 1 million of these procedures performed in the USA alone in 2021. And as we know, the population as a whole is aging, so these procedures are expected to at least double in volume over the next decade.